So at this meeting, my co-investigator, collaborator, Dr. Wang, who is the PI for this study at UCSF, presented an updated result of Alnuctamab. Alnuctamab was previously known as CC-93269. This is a bispecific T-cell engager that has 2 domains against BCMA and 1 domain to CD3. That had last been presented 3 years ago at an ASH meeting when we showed the data with the dose finding with the IV formulation. Now we have a much larger cohort of patients, and that therapy has transitioned from being an IV formulation to a subcutaneous formulation. And when you compare to the IV, you see a blunting of the cytokine profile and of the severity and frequency of CRS. So we essentially had no grade 3 or higher CRS, yet with a preserved high level of activity with nearly a little bit more than half the patients responding across the higher doses. Importantly, and perhaps as a differentiator to other BCMA-directed T-cell engagers in development, is that we're dealing with subcutaneous fixed dosing, and the schedule of administration that has been part of the entire development of Alnuctamab is one that is of de-intensification of therapy. So patients receive weekly therapy for the first 3 cycles, every 2 weeks therapy for the 3 subsequent cycles, like a 4, cycle 6, and beyond that is once per cycle subcutaneous administration. We see no CRS emerging after the step-up dosing, and we have had a relatively low rate of infection on those patients. So we remain hopeful that this might be a very helpful next therapy, BCMA T-cell engager, that will be helpful to patients and may have some potential or at least theoretical advantage over others that are also in development.